Yeah, this is a response to Chris's response to my response to Chris's video on socialized medicine. I watched this video and I thought it was so damn funny that I was felt obligated to make one more, at least one more response to his video. Essentially, in Chris's response to what I said about his video, he doesn't argue anything different. I find it funny, and I'd say if Chris doesn't want to inject any type of logic or evidence or any of these things into his argument, who am I to force him to? If he's going to keep saying the same thing, that's on him. And he doesn't argue anything different in his video. And, I'm not going to keep repeating the same damn thing over and over that I've put in other videos. You can just watch them again to see my argument. But I wanted to comment on a couple of things that Chris made at the end of his video, which I thought were so damn hilarious that they warranted a response. Chris apparently thinks it's wrong. Apparently thinks that economics isn't a science, which I just find hysterical. And it tells me, Chris, that you don't understand what a social science is. Yes, a social science studies the interaction of individuals in society, such as economics, political science, anthropology, psychology, sociology. All these things would qualify as social sciences. But he thinks he apparently doesn't think that a social science requires any type of logic to determine how it works. Chris apparently feels it's all based on emotions. And Chris argues that people like me don't advocate emotion. That if you call me arrogant, I don't know how I could come off as arrogant. That's news to me. But he says that people like me are wrong for viewing a field like economics in this way. And I'd say it's not that I'm wrong. It's just that Chris adheres to a brand of economics that most economists wouldn't really believe. You see, Chris doesn't explain the difference between positive economics, how the market works, which is what I advocate. I look at relationships and how people interact and what government policies do and what results from them logically and to base my arguments. But Chris practices something called normative economics. And normative economics is not how the market works, but how it should work. And that's precisely how people like Chris advocate these programs for socialized medicine. They say that they're better for the economy or they're better for people, contrary to what all the evidence says. But he's not actually advocating anything that's economically sound. He's advocating how he thinks it should work, no matter how detrimental and horrible the system would be. And I'd say he says something about Paul Krugman, or what Paul Krugman says, and I always find it funny when people like him will support Paul Krugman, because it's very true that Paul Krugman is probably the biggest welfare state advocate in mainstream economics today, based on the fact that he won the Nobel Peace Prize a couple of years ago. But I wonder if Chris realizes that Paul Krugman, despite the fact that he advocates it, realizes that everything that's wrong with the welfare state. He's argued against everything from minimum wage to farm subsidiaries to government rent controls, which is essentially what the government would do with healthcare in a single-payer system. And his famous quote was, I believe, something along the lines of, anyone who would deny that the free market works would also deny that evolution happens. And I'm sure Chris would find that quote hysterical if he could find it. But anyway, Chris isn't arguing anything that's economically sound. Again, he's arguing how he thinks the economy should work, and I'd say there's nothing wrong with having an opinion, a subjective opinion, because we all have opinions, obviously. But there's something incredibly wrong with saying, no, it's the fact, and no, the economy should work this way because it's going to be beneficial when all the evidence is against that. So, Chris, again, I go back to what I said in my response to you. I find it funny that you put so many videos commenting on religion, where you no doubt use logic and reasoning in your arguments, but when it comes to the economics, no, logic plays no role in that, and we should throw it out the window, and so it doesn't matter. Another quick comment I wanted to make, though, is Chris takes offense to the fact that I accused him of hiding a statistic, and I believe he was hiding it, and I haven't changed that opinion. He in his first video, he didn't include the actual numbers of doctors in certain socialized systems, because in the two biggest socialized systems in the world, Great Britain and Canada, they have less doctors than America, and that would, and logic would tell us that would make sense, because when you're not paying doctors as much and you're controlling how much they can spend, people are going to be driven out of that profession. Incredibly true in Canada, where I don't know if Chris realizes this, the way that they try to save money is they cut down on funding doctors in medical school, because that was how the Canadians felt that they could save money for the system, and of course it created a massive doctor shortage, so it had the opposite effect. But Chris comes back and says that he didn't include it because the nurses, the level of nurses apparently in Canada, and the level of nurses in these countries offset the cost. And I find that incredibly funny. because Chris states that you know he can't determine how many nurses equal a doctor, and very true. I can't determine that, and I don't know anyone who could, because I'm sure we would all have have a different opinion of how many nurses would equal a doctor. But I find it also funny that Chris seems to fail to realize that, well, if you're not training doctors and you're training more nurses, you're making the system worse, because the really expensive things that are bankrupting us in this HMO system, Chris, the heart surgeries, the cancer treatments, you know, those really expensive surgeries that cost hundreds of thousands of dollars, the reasons those are so expensive is because there's not enough doctors performing them. I don't know how many nurses could perform open heart surgery, how many nurses could you know, adequately perform, I don't know, chemotherapy or whatever, or these really, you know, the really expensive shit. And I'd say the way to lower those costs would be to get more people who could perform these. If you had 50 heart surgeons in a hospital, a quadruple bypass would not cost you $100,000 or however much it costs. So I found that point particularly funny, because I do believe Chris didn't include it, because the statistic hurt his argument. And I'd say it's funny when he comes back and says, well, you know, they're nurses and physician assistants apparently, and those count as a doctor. Well, no, they don't, because they can't perform the really expensive shit. And if you don't get people who can perform that expensive shit, Chris, the costs don't go down. And the last comment I wanted to make on your video, which I really found funny, is he apparently put words in my mouth and stated that I believe the free market can never fail, and that the free market is always good. I would never advocate such a thing, and I've never said anything. So Chris is putting words in my mouth. Is it true that the free market can have hiccups and it can create problems? Yes. I don't believe it can create problems as big as the financial crisis we're in now. I don't think the free market, if it tried, could fuck up that badly. And it took things like the Federal Reserve and a hysterical lending policy of the government to make a system that bad. But what people like Chris who study, you know, normative economics, not positive economics, don't understand is that while the free market will screw up, and of course it will, every free market will have hiccups and will have problems. The point is that the free market will correct itself in a relatively short amount of time. And again, that's what people like Chris don't seem to understand, is that, you know, the government intervention caused the financial crisis we're in now, and now we're intervening more, doing this massive stimulus that hasn't created any more fucking jobs, because we still have over 10% unemployment, and the real rate is closer to 17%. You know, the government intervention keeps creating problems, whereas if this was a true free market crisis, number one, it wouldn't be that big, and number two, it probably would be over by now, because then the resources would shift to the good industries, the bad businesses would fail, and yes, people would be employed, and yes, it would hurt, but the point is it would be over soon. So I guess the question is, would you rather, because you lost your job, work a part-time job at McDonald's for 3 years, waiting for the market to recover because of massive government intervention, or would you rather be unemployed for 9 to 12 months, but then be able to go back into your high-paying job? You know, again, that takes a little bit of a subjective view on what you would prefer, but the free market view would be faster. So anyway, I found Chris's video extremely funny. He didn't argue anything different, and I'd say I can keep saying the same logical things that he apparently doesn't like till my face turns blue, and it won't seem to convince him. But again, you know, I thought his video was funny, so I thought it warranted a response, and this was just, you know, responding to a couple of comments that he made that I thought were particularly funny. So yeah.